Hey everybody. Hi, it is Dr. Mary Claire Haver. I am a nutritionist, certified in culinary medicine, and a board certified OB-GYN, and I'm coming on live today to talk to you about how to fight inflammation. Oh wow, okay. So I'm going to wait just a second or two for some of you to join live and jump on here. I'm so excited to share this with you. Fighting inflammation is one of my favorite topics to discuss. And as always, feel free to share this video. And I think on my phone, it's down here, this little arrow button, and like this video so TikTok keeps showing it to the algorithm. I would be remiss if I didn't start out by saying I'm going to be talking about some supplements today, some of my favorite supplements that are inflammation fighters. However, as a culinary medicine specialist, it's important to remember that supplements are not meant to take the place of good nutrition. Supplements are meant to supplement a healthy diet. You cannot swallow a handful of supplements and expect it to undo any of the damage that a pro-inflammatory diet can reach. That's not how it works, okay? Now, I am going to talk about supplements today, but again, this is only to be utilized with good nutrition. So you see me glancing over here. Actually, I'm going to move my phone over because I have all my notes over here. I want to make sure I don't miss anything. So for those of you who don't know me, I am Dr. Mary Claire Haver. I am the creator and founder of the Galveston Diet. I am a board certified obstetrician gynecologist, and I'm also a nutritionist who is certified in culinary medicine. Okay, and TikTok keeps sending me notifications. Please like this video so they keep showing it to people in the algorithm. And also share this video with anyone that you think it would be helpful to know. So supplements, remember, we're going to talk about supplements, but supplements cannot match the nutrition and health advantages eating entire meals filled with lean meats, fruits, veggies, legumes, and all of the foods that are naturally pro-inflammatory. Compared to supplements, whole food has three distinct advantages. Number one, more nutrients from dietary complexity. Okay. Number two, vital fiber to avoid constipation and many illnesses. Fiber does lots of things, and I'm going to talk about fiber specifically here in just a second. And proactive components like phytochemicals, okay, that are antioxidants, anti-inflammatories, and have specific disease-fighting properties. Phytochemicals can also help prevent cancer, heart disease, and diabetes. Okay, that being said, most people in civilized countries eat a typical Western diet pattern, which has been linked to multiple inflammatory diseases. So the reason why so many of us are inflamed has a lot to do with the pattern of our eating, not eating one specific thing. I mean, I cannot tell you, as a physician and a nutritionist, I have people who want a magic bullet. They just want to take one thing, a pill, a potion, something that's going to fix all their problems. That's not how it works. It is more to do with the pattern of what you eat, the routine in your day, the habits that we make, okay? People ask me if food is good or food is bad, if this particular food is good, food does not, as my daughter who's a nutrition science major, Mama, food does not have morality. Food is not good or bad. Okay, it might be more nutritious, it might be pro-inflammatory, but we need to stop assigning the tag good or bad with food. You can eat almost anything that's not poisonous and you won't die from it. It is the pattern of consistently eating things that are pro-inflammatory of how our health patterns are going to develop based on our nutritional habits. So everything I'm going to tell you today is scientific, some of you don't like science, so just take me for my word, but is scientific and evidence-based, meaning there are studies versus placebo that absolutely prove this, or they've done observational studies looking at populations where they see definite patterns of nutrition and improved health outcomes. All right, so I'm going to give you a second to get your pens and pencils out, because TikTok does not, it stores the video for me, but you cannot go back and watch this. And I know a lot of you are going to be interested, and I'm going to talk specifically about products that I like. Again, I don't get paid for this. I don't have links or anything. I do create a few products myself through the Galveston Diet. I will be open and honest about that. Okay, so the typical Western diet is noted, number one, for having a fatty acid ratio that promotes disease. So what the hell is that, Dr. Haver? Okay, when we talk about fatty acids, there are basically three in our nutritional profile: omega-3, omega-6, and omega-9. Omega-9 is basically neutral. Don't worry about it. It really doesn't really play a part here. It's omega-3 and omega-6. So while we were evolving as a species, we ate about an equal amount of omega-3 to omega-6. It was pretty much equal in our hunter-gatherer diets, okay? And that is what our body thrived on, by what was available at the time. Now, because of the commercial processing of food and the tendency for people in the Western world to not eat foods rich in omega-3, we are eating 20 times the amount of omega-6 that we used to. Omega-6 in and of itself, in moderation, there's nothing harmful about it. We need it. It is an essential fatty acid. However, we are eating 20 times more than we should be. 4 to 20 times more, depending. Okay, and it becomes pro-inflammatory. The breakdown products of omega-6 are pro-inflammatory. The breakdown products of omega-3 are actually anti-inflammatory. So that is a typical Western diet. You're eating way too much. Why? Because the vegetable oils that are used to use as oils or fats in processed goods, so almost every cookie, cracker, that you eat that comes from a vegetable oil is very, very rich in omega-6, and we're eating tons of that because of convenience, because of marketing, because of whatever. And we are getting way too much omega-6 in our diet. So in the Galveston Diet, in my program, we talk about the omega-6 to omega-3 ratio. Here's the other problem. The FDA, as of now, does not require the amounts of omega-3 and omega-6 to be on packaging. Food companies are fighting this tooth and nail. So it is very hard to track how much omega-3 and omega-6 you're having. So here's what my nutrition professors taught me, like how to talk to patients about this, and how I'm going to just share this with you. Basically, you need to be making sure that you are getting one fabulous source of omega-3 a day, at least, if not more. You cannot OD on omega-3, okay? That's going to be salmon, your fatty fish, walnuts, flax seeds, chia seeds. It's all rich in omega-3. One great source at least, and you need to avoid the addition of omega-6, things that are cooked with oils rich in omega-6, corn oils, soybean oils, that kind of stuff, okay? So most of your packaged goods, anything in a bag or a box, is probably cooked with a high amount of omega-6 oil. So avoid those and try to stack your diet with things rich in omega-3. All right, so diets naturally rich in omega-3 fatty acids have been shown to benefit in several inflammatory and autoimmune diseases. Woo! So, including rheumatoid arthritis, Crohn's disease, ulcerative colitis, psoriasis, lupus, MS, and migraine headaches, okay? If you look up the data for ADHD, so many of you, both of my children, I have a variant, okay, of the way our brain processes stuff. Omega-3 fatty acid supplementation has been shown in some studies, especially in children, to be as helpful with their symptoms as taking ADHD meds. Shocker. Omega-3 fatty acid supplementation has been shown in studies, especially in children, to treat ADHD symptoms as well, if not better, than taking stimulants. Why are we not talking about this? Well, because no one makes money off of it. Nutrition is always, always key, okay? So an omega-3 supplement. So I've seen, like, if you Google omega-3 and you start looking this stuff up, you will see Oh, omega-6, omega-3, omega-9. Avoid those. You do not want to take extra omega-3 or omega-9. I mean, omega-6 or omega-9. If you're going to supplement omega-3, then you just want to supplement omega-3 by itself. Okay. Now, in the Galveston diet, I mix my omega-3, which comes from fish oil, with vitamin D because it's easy and they kind of go together. Okay, so you will quite often find an omega-3 plus vitamin D supplement. For me, it knocks out two birds with one stone, and we'll get to vitamin D in a second. So if you are a vegan or a vegetarian, there is an algae-based omega-3 supplement that you can find. I think Nordic Naturals is a good source. The way that the fish get it is the fish eat the algae. The algae is what contains the omega-3. And then the fish eat it, it gets stored. And then you eat the fish, it's stored in their fat, and there you go. So, okay. Number two. So omega-3, definitely something I would consider supplementing. Most Americans are not getting enough omega-3, and they're getting way too much omega-6, okay? Number 2, our bodies, especially the large intestine, contains trillions of microorganisms. We are not sterile. We're not sterile. The gut microbiota, a colonic bacterial population, has a huge role in immunology, health, digestion, mental health, and other bodily processes. Okay? We have healthy bacteria that live in our colon. It is very important to support them as much as possible. So it's important to support a healthy mix of good and harmful, a healthy mix of bacteria to support good health. Problems occur when this balance gets disrupted, and probiotics can be helpful in these situations. So what is a probiotic? Everybody always wants to know. A probiotic are the good bacteria that are comparable to those found naturally in the body. A greater variety of probiotic bacterial strains may be found in probiotic products on the market. So to reap the rewards, you must select the best product for what you are trying to accomplish. So when I go shopping, probiotics are found in things that are fermented, okay? Because the bacteria are placed in the food product to make the fermentation process happen. So yogurt, kimchi, kombucha, there's lots and lots of ways to ferment these products. And so when we eat them, we eat the bacteria, and then it helps to recolonize our gut with the healthy bacteria. So if you're going to go shopping for a probiotic, there's a few things you need to consider. One is there's a million of them out there, literally. You need to look for a reputable company that has third-party testing, because the FDA does not very rarely monitor these things, okay? The company does not have to prove what they say is in the bottle is in the bottle. So a company to make sure they're reputable will hire a third party to test the products for them. So you need to go on their website and look for a third party testing banner somewhere that's huge. Okay, the bigger supplement companies will do that. You want billions is better. You want a wide variety. You want lots and lots and lots and lots of cultures. Okay, lots of bacteria in your supplement, and you want as many varieties as possible to promote the best gut health. Let's see. And so I wouldn't pay too much attention if it said women's or, immune support or whatever. They're all basically the same. So get one. Billions is better. Look for third-party testing and as many cultures as possible. Okay. So, yogurt. So foods rich in probiotics naturally: yogurt, kombucha, sauerkraut, fermented pickles, miso. But many of these options are not utilized by those of us in the West. When I was in Japan on the high school field trip a few years back with my older daughter, I saw these people eat fermented foods all the time. They don't need to supplement. They eat them all day long. They have kimchi, they have all this stuff, breakfast, lunch, dinner, it's always there, always there. So it was shocking to me to see, wow, these people eat probiotic rich foods all day long. So, in rheumatoid arthritis, ulcerative colitis, multiple sclerosis, microbial alteration by probiotics has been demonstrated to alleviate gastrointestinal symptoms and multi-organ inflammation in several randomized studies. So, best probiotic supplements, choose one that has at least 1 billion. Billions is better, multiple billions. The one I have has 35 billion. I'm going to go big or go home. And it contains lactobacillus, bifidobacterium, and Saccharomyces, which are some of the most investigated, studied, and proven to be healthy products out there. So I'm getting notifications from TikTok. Hi, everybody. They make me reintroduce myself because so many of you kind of come and go. I'm Dr. Mary Claire Haver. Today, we're talking about products that naturally fight inflammation. These are supplements and food products. Please like this video. My like button's up here. Share this video so that I become relevant in the algorithm with TikTok. They're asking me for likes and shares and little emojis and hearts and all the things. So, okay, number 3. Everybody always asks me about this one. Number three is turmeric. Turmeric is a spice that is known for its therapeutic benefits. It has really piqued the interest of the medical community, and there are tons of studies being done right now. The primary source of it is a good, great, wonderful source of a polyphenol, which is a phytochemical called curcumin. So the active ingredient in turmeric is curcumin. So it helps with oxidative and inflammatory disorders, metabolic syndrome, arthritis, anxiety, and hyperlipidemia treatment. It's wonderful. Here's the problem. Turmeric, the curcumin available in turmeric is not really bioavailable, meaning you can eat a ton of it and very little leaves the gut and is absorbed into the bloodstream. So companies have tagged the curcumin with lipids or with piperidine to make it more bioavailable. Like you can manipulate the curcumin so that it is actually absorbed into the bloodstream. Turmeric in and of its own, you have to eat a ton of it, and the Western people just don't do that. There's been studies like in exercise-induced inflammation and muscular pain, active persons recover faster and perform better with turmeric. Let's see. I don't know who Galactic Cyclops is. Do I need to block them? You guys are just slamming this person. This is hysterical. I need to pop some popcorn. Y'all need to read the comments. This is funny. Let me block this person real quick because they're being ugly. Oh, what are my credentials? Oh my God, I am so glad you fucking asked. Okay, let's see. I have my undergraduate degree in geology from the University of Louisiana at Lafayette. I practiced as a geologist. I worked as a geologist for a couple of years where I had kind of a come to Jesus moment where I decided this was not my path. And I was a STEM major. I was very smart, and I had a 4.0 basically in math and science. And I was interested in medicine, but never felt like I was smart enough. Like typically raised in the South as a girl, stay home, clean the kitchen, and raise your babies. And so I really had to make that mental leap that I could do this. And so I was not pre-med. I was working. I got a book that said how to apply to med school. And it was like the idiot's guide kind of thing. And I just step by step, I registered for an MCAT study class. I drove an hour at night. I mean, I like did all the steps. I did the things. I took the MCAT class and I submitted my application, and I was accepted immediately. My grades were great. My MCAT score was good. So, but I didn't know, I wasn't pre-med. I didn't know all these people. And so I drive up to these medical schools and I do my interviews, and then boom, you're going. So within a year, I made a decision, filled in the paperwork, and got accepted to med school. I went to the Louisiana State University Medical Center in Shreveport, Louisiana, where I graduated, I think, 4th in my class. Medical school was like breathing. I worked my ass off, but it was like breathing. Here, memorize this. I did it. Here, do that. I did it. I mean, and I was working, I was tutoring, I was doing, I had no money, and trying to limit my student loans. I fell in love with obstetrics and gynecology while in school, felt like that was my path, and matched at my top choice of residency, which was University of Texas, and was there for 4 years, where I won numerous awards, and they offered me a chance to stay on as a professor, but my husband was a engineer with an oil company, and we decided to go to Houston, and then after 3 years decided to go back to academics. I was miserable in my job. It was a pyramid scheme. It was a long story. Anyway, so I went back into academics where I kind of was till 2018 when I became a hospitalist as a semi-retirement job so I could focus on the Galveston diet. And then now I own a clinic called Mary Claire Wellness where I teach nutrition and do menopause support while I run my business, the Galveston diet. So in 2019, I became certified in culinary medicine. It's basically, it's a medical nutrition degree offered by Tulane University for physicians, physician's assistants, for advanced health practitioners, and it is freaking awesome. So I think I'm qualified. If you find someone more qualified, just let me know. Okay, so turmeric. And somebody block that guy or report him. It's too much. All right, so let's go back to what we were talking about, which is... we are talking about inflammation and how to fight inflammation. Okay, so we talked about turmeric, we talked about probiotics, and we talked about omega-3 fatty acids. I just assume you were a guy because you seem to be kind of a jerk, but I'm sorry, and that was totally sexist of me. So I don't want to get in TikTok jail, but you just don't seem to be very nice. So if you're not happy with my content, leave. Okay, and stop bashing and stop doing all the things. By Galactic Cyclops, y'all give me 1 second so I can block this person. Wait, it's not letting me. I'll do it later. Okay. All right. So 42%, and the comments are flying by so fast and my eyes aren't that good. So if I misinterpreted something, but you upset a lot of people. Okay, so vitamin D. This is number 4, vitamin D, vitamin D, vitamin D, vitamin D. You hear me preach this. If you guys follow me, you hear me preach this from the rooftops. Here's the deal about vitamin D. I'm going to give you the exact statistics. 42% of Americans are deficient in vitamin D. For a menopausal woman, that number reaches 85%. I check vitamin D levels on every single patient, and it's about 80% that are deficient, okay? There's many reasons for that. We're not absorbing it very well. If you've had any gastrointestinal issues, or surgery, you're not going to absorb it very well. We are not getting as much sun exposure. We live in places that don't have a lot of sun. We have darker skin, which is not allowing the conversion of the calciferol to active vitamin D. So there's a lot of reasons why this is happening. And vitamin D has so many receptors in our body, has so many actions. Vitamin D is like everything: hair loss, weight gain, heart disease, depression, anxiety, everything. If you're low in vitamin D, I'm like, we got to start there. You got to fix that first because it could be causing so many of the things that you are feeling right now. So vitamin D, besides osteoporosis, chronic fatigue, oh my God, it's crazy. So vitamin D supplementation has been shown to be helpful in a number of disease states. This is one of the ones I'm like, everybody should supplement vitamin D. Everybody. Why? Because it is hard to get it through nutrition. It's hard. Okay. Mushrooms are the only, if you're a vegan or vegetarian, mushrooms are the only thing that have vitamin D that you can eat. And so you have to eat a mountain of them in order to get enough vitamin D through nutrition. So if you guys cannot figure out why you're inflamed, what's going on, I would absolutely supplement in vitamin D. Everybody wants to know how much. If your vitamin Ds are tip-top, normal, great. When they talk about the recommended daily intake for any nutrition, for any mineral, vitamin, whatever, that is the amount to keep your levels normal, not to pull you out of a deficit. That's different. Okay, so for vitamin D, if your levels are normal and you're just trying to keep that normal level up, you need about 600 international units a day, 600 IUs. That should keep you stable, okay? Number 1. If you're deficient, it depends on how much. Somebody put glasses on me. That's so cute. Okay, if you're deficient, here's what I do. And now this requires a prescription and you need a physician to follow you. But this is what I do for my patients. I put them on okay, so you could safely supplement up to about 5,000 a day without worrying about becoming toxic. Okay? Most people can supplement up to 5,000 a day. I take 2,000 a day because my diet is rich in some of the animal products that are the fatty fish that have vitamin D. Okay? And there's some foods are fortified with vitamin D as well. Okay, so I take about 2,000 a day. I check my levels routinely. They're fine. If someone comes and they've got a level of like 20, 10, 15, whatever, they're low, I put them on a weekly dose of 50,000 IUs for 10 weeks so they don't get toxic. I do a rapid amount to bring them up. We recheck where they're at, and then they go on a maintenance dose. Okay? But that high of a dose must be monitored by a healthcare professional. You cannot take that much on your own without running the risk of toxicity. That is not anything that cannot be monitored. Okay? So daily dose, you can probably go up to 5,000 and be fine without running the risk of, okay. So, and number 5, fiber. Guys, fiber, and then fiber. 50% of Americans are not getting enough fiber in their diet. Okay? Where do we have fiber? All right, I want to see what you think. Where do we find fiber in nutrition, in your food? What foods are rich in fiber? I want to see the comments. Just start naming things rich in fiber. Veggies, yep. Apples, yep. Dates, absolutely. Broccoli, yep. Spinach, kale, apples, fruit. Whole grain yep. Whole grains, absolutely. Beans, huge. Lentils, broccoli, oatmeal, carrots. Beans, legumes, whole grains, oatmeal, green leafies, peppers. I got to look up that one. Chia, yes. Seeds, nuts, things that crunch. Okay, veggies that crunch. Berries, apples, pears, legumes, which are your beans, okra, and whole grains. Whole grains. Corn is a whole grain. Whole grain wheat. All rich in fiber. Flax seeds, absolutely. And my favorite, avocado. I hit my goals because I get an avocado a day in. It's healthy fat and fiber. So freaking good for me. Okay, so C-reactive protein, which is something I routinely check on my patients in clinic, adequate fiber will go down. So here's what I tell my patients. Strive 25 grams of fiber per day. So have y'all seen my video on the rules of 25? The rules of 25, okay? If I only told you 3 things to do, okay? No more than 25 grams of added sugar per day, at least 25 grams of fiber per day. I push for 35. And 25 minutes per day average of some kind of exercise, a combination of aerobic activity, stretching, and balance, okay? My top tips. So, fiber. Do I supplement fiber? I'm actually got it right here. Yes. This is a water bottle. I had a long road trip yesterday. I forgot my water bottle from home. I don't like buying plastic, but I was stuck. And so I feel guilty, so I reuse this over and over again. So anyway, I have my own fiber supplement from the Galveston diet that I created because I can. And I wanted to make sure it had exactly the kind of fiber that I wanted in it. It's got a little bit of stevia and monk fruit for taste. If you've ever done a fiber supplement, hang on. Without flavor, it's also got an orange flavor, like creamsicle. And so this has 7 grams of fiber in it per scoop. But my diet, I'm hitting 25, and this will help me push closer to 35 because I have a pretty nasty family history of cancer, and my gastrointestinal system needs all the support necessary. Also, soluble fiber in this. So mine is a mix of soluble and insoluble fiber, and they have very different jobs in the body. Soluble fiber is what feeds your microbiota. It is the prebiotic. You don't have to take a prebiotic if you just eat the right things. Okay? So, so amazing. So the majority of your fiber should come from food. So I will recap. So for those of you just listening, hi, I'm Dr. Mary Claire Haver. I'm the creator and founder of the Galveston Diet. I'm also a board certified obstetrician gynecologist, and I am certified in culinary medicine, which makes me a nutritionist. I am here today talking about inflammation and nutrition and ways that you can fight inflammation through nutrition. So I will now go ahead, put your questions down, and I will get some questions answered for you guys. So as a recap, I talked about my top 5 supplements. Okay, but remember, supplements do not undo poor nutritional choices. They also should never replace a healthy diet. So number 1, omega-3 fatty acids, absolutely, as well as avoiding things with rich in omega-6, not things that have omega-6 naturally found in them, like a few nuts, okay? I'm talking about the extraction of oils like corn oil and vegetable oils high in omega-6 that are then used to make cookies and crackers and cakes and breads and all the things that we eat too much of, therefore jacking up our omega-6 levels. Number 2 is probiotics. If you eat a diet, if you get one good source of probiotics in your diet every day, you're probably doing fine. Otherwise, you should consider supplementing. I do supplement. Billions is better. I do one that has 85 billion in the culture and multiple strains, like 35 different strains. So you want to have a big variety of the strain and as many cultures as possible. And then number 3 is turmeric. So remember that turmeric in its natural form is the curcumin, which is the active ingredient, the phytochemical that is in turmeric, that has all the powerful antioxidant, anti-inflammatory properties, is not really bioavailable. So you know, if you're just eating a lot of turmeric, it's not really going to give you a high level of curcumin that is going to be able to be absorbed and used in your bloodstream. So there are different formulations of curcumin that are coming out that have like piperin attached that increases absorption or has different lipids. I'm coming out with one next year that we're combining it with a lipid that will increase absorption, basically. And then, of course, vitamin D, and then fiber. If you're looking for a supplement, remember, only if you're eating a good, nutritious diet. If you go to galvestondiet.com, we have a fantastic website, and we offer omega-3 and vitamin D combination. It's called omega-3 plus D. Shocker. And then we have Galveston GDX Fiber, which is a fiber supplement, so that I just absolutely love. The other thing is, I know we have if you go to Facebook, I'll get the link up for you guys. I'll put it up later, but we have a new holiday survival guide, healthy holiday survival guide that I'm putting together of just quick and easy tips and tricks to help you get through the holiday as soon as possible. But we have a sale. So if you're interested in the Galveston diet and you figure it's time to pull the trigger, I've watched this woman forever. I hear this all day long. And now I'm ready. We have a 20% off sale. Our program is all a one-time fee for whatever package you pick. We do have a VIP kind of community. That's a monthly fee, but that's optional. That is not part of, that takes a while for you to join. We just don't that's a very VIP group. You don't just run and join that in the beginning. That you have to be invited. So don't worry about that. That is a monthly charge, but that's not for you. If you're new to Galveston Diet, it's a one-time fee. And you pick whatever package that you want, and all packages are 20% off. You just need to use the code HOLIDAY, HOLIDAY, holiday. If you click up here on my picture, it's up there. It's at the top. You see it says use holiday to save 20% in the bio. And there's a link to our website where you can go check out Galveston Diet, check out all of our offerings, read our blogs, see if you feel like this program would be a good fit for you. And then also you can see a link to the supplements if you want to check those out. Those are not on sale, maybe for Black Friday. I don't know. I haven't decided yet, whatever. But they're very reasonably priced. We don't make a ton of money off of them. Hang on. My fiber. I got to get through this before dinner. So questions. Hang on. I'm looking. Let me go back. There's a few. Do I recommend digestive enzymes for optimal nutritional something? These go by so fast, guys. I'm sorry. 78 new messages. Oh, my God. Do I believe in inflammation from parasite infections? I think that parasitic infections, at least when I talk to gastroenterologists, and I know that there was a big TikTok craze about deworming and whatnot. If you live in the United States, now if you live in a country where you don't have plumbing or adequate sanitation is an issue, and you are diagnosed with a parasite, then absolutely you want to get rid of the parasite. But what's happened in the U.S. is that people have jumped on this craze to put poisonous things in their body to get rid of parasites they actually probably don't have. And so, but you know what? I that is not my area of expertise. I rely on people smarter than me or who focus just on that, and they come to me for information about menopause and things. So the gastroenterologists that I talk to are like, that shit's crazy. But you know what? You do you. Can I speak about alcohol? What do you want to know? Let's see. Oh, Blakey sent me a bunch of emojis. It's my daughter's friend. She loves me on TikTok. Hey, baby, mommy's on live. My daughter just walked in. What about turmeric? Do we supplement? You can, but remember that the bioavailability of turmeric in its native form is not very high. You have to eat a ton of it in order to get your blood levels up. Look for a supplement that has high bioavailability. It's usually one that has piperidine, like the active ingredient in pepper, bound to the curcumin. Curcumin is the phytochemical that is the active ingredient in turmeric. You okay? So you've been on weekly dose of vitamin D for a year and still deficient, fluid retention, and weight gain. I would see a gastroenterologist. It's time to see a specialist. Is alcohol considered added sugar? Some alcohols have sugars added to it, and it should be very clear on the label, not all. So, okay. Inflammation causes autoimmune disease. Inflammation makes autoimmune disease worse, for sure. And they kind of feed on each other. Let's see. Can you reverse type 2 diabetes with diet and exercise alone? Yes. 100% of the time, no, but the vast majority of type 2 diabetes can be rendered cured with the right nutrition and exercise changes. Absolutely. Hang on. Yeah, babe.
Can I make a cauliflower pizza?
I have chicken in the crock pot to do the tacos. Okay. Fiber and ulcerative colitis. That is not my area of expertise. I'm not a gastroenterologist, so I can't specifically speak to that medical condition. Let's see. Best time to take supplements, AM or PM, with or without a meal. Okay, so it depends on what you're treating. So I fast. My choice to fast is in the morning. So I do not take my supplements on an empty stomach because they nauseate me. I don't think that they would work better or worse or anything like that. If I do that on an empty stomach, which I've done a couple times, I will throw up. So I don't do that. I wait till I break my fast, and then I take my supplements as I'm sipping my fiber and I put collagen in here too. So, and my supplements are for me. They're what I need based on my nutritional patterns, my needs, etc. Now, I also take magnesium L-threonate or Neuromag, specifically to help with sleep. That is for medical reasons. I am not deficient in magnesium, but I take it to help with sleep for the medical benefits. I take that at night so that I get the peak dose when I'm trying to sleep. Remember, all things that you ingest take a couple of hours to get through your gastrointestinal tract, and then you get your highest levels in the blood. So for that, I take that in the evening so that I reach my peak blood dose. My plasma dose is the highest when I am sleeping or trying to go to sleep. And that is why. The rest of the supplements I take during the day. Okay, I'm reading the questions. Symptoms of inflammation. Hey guys, you want to help her out here? What are your symptoms of inflammation? Because where do we begin? Redness, swelling, fluid retention, brain fog, constipation, diarrhea, headache, cramping, not feeling well, just a general feeling of malaise, being tired all the time, depression, anxiety, so much. Yeah, joint pain. Let's see. Magnesium made you constipated. You're taking the wrong kind. Magnesium should make you poop. That's one of the side effects. Let's see. Your ANA is elevated and may have rheumatoid arthritis. Looking for anti-inflammatories. Just bought ginger and turmeric. But, remember, if your entire pattern of eating is not supporting an anti-inflammatory nutrition, then no supplements are going to help you. So first start with what you're eating. It's the pattern of what you're eating that is the most important. Supplements are only supporting that. Okay, you are not undoing pro-inflammatory nutritional choices. I have a nutritional inflammation quiz on our website if you want to go check that out. Our whole program, the backbone of the Galveston diet, is anti-inflammatory nutrition, and we're having a sale. The code is HOLIDAY, HOLIDAY, to save 20% on your choice of program. It's a one-time fee. If you want to go check that out, you are more than welcome to. Okay, I'm going to have to get off here in a second and get dinner going. Okay, I'm looking at the messages. Supplement for memories, omega-3 fatty acids. Thank you. I appreciate you. You're welcome. Okay, great. They're repeating. What do you suggest a gastro for my vitamin D? Turn. Cute. Oh, very cute. Will they shrink anymore when you wash them, or they're fitted? They look great.
Will they shrink?
Like I think they fit perfect right now, and if they got any smaller, you might be uncomfortable.
No, they said the first time that they're on it.
They stretch. Okay, they look amazing. I love them. Her new jeans. Sorry. You want to come show them off? Okay. She hates it when I do this. Okay, so, I'm getting a notification. I'm Dr. Mary Claire Haver, creator and founder of the Galveston Diet. I'm also a board-certified OB-GYN and a nutritionist. Please like this video. TikTok makes me say these things so that I remain relevant in the algorithm. And they ask for me to ask for likes and to ask for hearts and to ask for you guys to share this video with someone that you think will be... How many times are you going to ask? It's annoying. Oh, you're not talking to me. Okay. How long do I fast? So I practice a daily intermittent fast of approximately 16 hours. I eat in an 8-hour window, and I fast in my day. What works for me and my schedule is from noon to 8 p.m. Now, my daughter, who is studying nutrition, she's getting a degree in nutrition science from Louisiana State University, go Tigers, sent me an article today where they looked at people who fast. I need to read the article in detail and see if they looked at women, if these were just some 25-year-old dudes, and they did a comparison to time of day feeding, that it looks like some of the diabetes things, like the insulin resistance, is better when they fast in the evening. But I don't know yet. I need to do a deeper dive into it, but it was interesting. Okay, I am on progesterone, okay, from endometriosis and anti-inflammatory diet, mostly high in estrogen, worse endo. I don't know. I'm sorry. That was tough. What do I ask to get checked to see if you're perimenopausal? Okay, that's a great question. So if you have not taken the perimenopause quiz, basically there's no blood test to 100% determine if you're in perimenopause. Because our levels fluctuate so much in perimenopause, a blood test is not really helpful. It's age, symptoms, family history, and there is a validated scoring system for perimenopause. I have it on my website. It's called the Perimenopause Quiz. If you go to galvestondiet.com, you can go check it out. And it will give you a score and then take you to a ton of information on treatment options, medications, things to talk to your doctor about so that you are more informed. Okay, guys, wonderful time chatting with you, and we will chat again soon.